Hi, what's up, guys? Welcome back to another episode on the show Behind the Scenes in Health with Dr. Ron. If you're new to this channel, my name is Ronald, and we basically talk about everything that happens behind the scenes in health. And thank you for stumbling on my channel, and I hope you just hit the subscribe button because we push out amazing content on this channel. To my returning viewers and subscribers, thank you guys for always sticking around, and because of you guys, this channel is going places, right? So on today's episode on the show, I'll be talking about becoming director of public health. Now, interestingly, a lot of persons tend to look down on public health physicians, and it doesn't really make sense, from my own perspective. And because public health is a very rewarding career, you make a lot of impact. During COVID-19, the height of COVID-19 pandemic, we saw the impact the public health physicians really played. That not trying to downplay the contribution of every other member of the healthcare task force or healthcare members really, but they really played an impact, right? So I'll be talking about skill sets required, qualifications, what the salary expectations are, and how you typically get to this point where you're a director of public health. So first and foremost, for you to become a director of public health, it's good to know that the director of public health is a very senior management position where you're responsible for overseeing the whole vision, the objectives of the healthcare system. So for example, you're working in the Ministry of Health and you're now the director of public health. Typically, you're just at the top there, making all the strategic decisions about how public health is going to be run and executed. So to embark on that journey, first of all, you need a very strong educational foundation, and typically that will usually start with having an MBBS or MD. Basically, you have a medical degree. Then occasionally you need to have a master's in public health. Now in other climes, you probably need to maybe do a residency or belong to the Royal Society of Public Health Practitioners or things like that, really. So that adds an extra layer of qualifications on your first degree. Then the most important part after acquiring all this certification is to actually have practical experience in public health. So if it's through research, if it's through clinical work, if it's through field work, really, you need that experience really in public health. So typically most people will usually start their career maybe as a public health analyst. It could be as a public health, maybe epidemiologist. It could be as a program manager, and these roles actually now give you the required hands-on skills that I mentioned about that you need to have to say, yes, I've actually worked across several roles in public health organizations in different places to get, basically understand the complexities of public health issues. Now, because, for example, if you talk about something in quote as little as sanitation or hygiene, it sounds little, but it's really, when you now want to break it down, it's complex. So we need people who have a very good understanding of the complex issues about public health problems and all of that. So as you move ahead, you gradually transition into managerial roles, become a program manager, then you get into director of public health position. And for you to excel, let me not use the word excel excellently, for you to excel as a director of public health, there are very key skills that you should be looking out for, or if you don't have, you should start thinking of developing them. And you need a strong, diverse set of skills. So number one, leadership is very, very important. You're practically the head of the organization, so you're leading large teams. So that leadership and ability to manage people is very, very important. Then the skill set of strategic thinking is also very invaluable because you'll be guiding initiatives that impact communities on a large scale. This is why a lot of people like public health. In their own words, little they do impacts a very large subset of people Unlike they'll say maybe other people are treating one person's, the impact is not much. But again, that's conversation for another day. That skill set you might want to look at is excellent communication skills, because you'll be collaborating with government agencies, you'll be collaborating with healthcare organizations, hospitals, and different types of stakeholders. So that communication skill is very, very important. Others are analytical skills, problem solving skills, and a very deep understanding of public health policies, really. Then you might want to ask, after all of this work, how much am I going to earn? So globally, it's quite rewarding, but your salary is based on your location, your experience, and the organization you're working for. So in the United States, for example, you'll probably be looking at an average salary of 100,000 to 150,000 US dollars annually, which is not bad, really. While in the UK, you're probably looking at 80,000 pounds to 120,000 pounds annually, which is still not bad, you know. So these are just averages. Like I said, they will differ on location, experience, and skill sets, right? So if you're in public health and you're thinking, how high can I go? Yes, this is one of the how highs you can go. So basically, I think I've answered that question. So you can actually become a director of public health. So if you're in public health, you're watching, then keep up grinding, do the work you have to do. Then hopefully I get to see you at the top, right? So don't leave without subscribing. If you enjoy this video, subscribe to the channel, share to your friends and colleagues, and to let them know about the amazing content we put out there. And if there's any topic you want me to talk about, any career, because I'm big on alternative careers, just talk to me about it. Put it in the chat there, and I'll probably make a video for you. I'll bring in somebody, an expert, to talk on the live segment of the show, and yeah, get into the nitty-gritty. So until I come your way next episode, I still remain your host, Dr. Ron, and like Aproko says, drink water. Bye for now.